You see the COVID case numbers on a daily basis before we do, record-breaking numbers on a daily basis. Your reaction to where things stand in the state?
Well, our real focus right now, of course, is on hospitals, and our hospitals in Northeast Ohio are, overflowing. I was on a call this morning at 6:30 with hospitals around the state. There is some good news. The good news is that it would appear that the cases in Northeast Ohio may have plateaued. They're not going down yet, but we're hopeful that we will in fact see that. As of tomorrow morning, we'll have over 2,200 members of the Ohio National Guard in hospitals around the state and in testing sites. We're putting emphasis on testing sites, frankly, to alleviate the push of people going into the emergency rooms, which is another thing that is overcrowding our hospitals.
The legislature took away your ability to issue health orders in March, overriding your veto. Safe to say, if they had not done that, would you have issued by this point a mask mandate for schools?
Well, I've strongly recommended, but more importantly, children's hospitals have strongly recommended that every school in the state, at least during the month of January, mandate masks. And we are seeing some of those go back to mandating masks. And I think it should be a realization that we're in a very difficult time. We are seeing more children in our hospitals than we have seen in the past. And frankly, our children's hospitals are very concerned about that. So strong recommendation, we're not going to mandate anything, but if the schools want to be able to stay open in January, and be able to have bus drivers and be able to have teachers in the classroom and kids in seats, the safest way to do that, at least for the month of January when we're dealing with this Omicron surge, is for the kids to be masked.
Cleveland schools went virtual this week. They'll make a determination on next week and the next day or two based on the health data. Your advice to them?
Well, I think that's a mistake, frankly. I think kids need to be in school. And, if they're masked, if people are careful, we've demonstrated that the spread in schools is not great when kids are masked. And we've also found out, the difficulty that kids have when they're not in school. So I'm concerned if schools today are starting to close again. That would be, I think, in my opinion, a mistake. I think we should go back and look at what the pediatricians have told us. We should look at what the children's hospitals have told us. They have all said kids need to be safely in school. So masking, keeping distance, being careful, but in school.
The legislature also now limits a state of emergency in Ohio to 90 days. They can override it after 30 days. But with Omicron, 30 days may be all you need. Is that something that is on the table?
Well, as far as health orders, the legislature actually, under the bill that they passed over my veto, they have the ability to come in the next day and override any kind of health order. But, I think what we really need to continue to focus on is the vaccines. It is powerful. We have now 70% of our adults in the state of Ohio who have been vaccinated. We continue to urge people to get the boosters. We're getting, last month, I think we had over 1 million people in Ohio who got their booster. We're encouraging everyone who might be watching this, get your booster. With your normal vaccine plus your booster, you're in pretty darn good shape to stay out of the hospital. Very, very few people are going to the hospital who are fully vaccinated. The people who are crowding our hospitals today are people who simply are not vaccinated.
New cases. We're seeing about 20,000 a day over the course of the past week, give or take a few hundred. Do you think that's really where we are in this state, or is that merely the ceiling that is now set based on the limits of testing?
Well, we're recording, I think, about 78,000 tests every day. But we also know there's a lot more tests that are going on that are not being reported. And frankly, that's okay. We want people to have the information. We invested in the state in 5.5 million test kits that we have been getting out to people through the libraries and through the health departments. And we know that in many cases, people do not report the results, but we think having that citizen informed, knowing whether he or she is in fact infected, whether or not they do have the coronavirus, is very, very important and outweighs any concern about getting it reported. So we know there's been a lot more tests than are being reported.
Finally, I would be remiss if I didn't wish you a happy birthday. If I may be so bold, as you stand before the candles on the cake tonight, what might be your wish?
Well, as far as the candles, we'll do a clap, I think, tonight. I think we've learned not to be blowing on our cakes, at least during this pandemic. Look, my wish is for my kids and my grandkids and everyone's kids and everyone's grandkids to have a great future. That's what this is about. That's what we do every single day. What I do every single day is try to make a better Ohio, an Ohio where people can grow and raise their families and do well. And that's really my goal.